All right. Hi, everyone. I'm going to go ahead and recap what happened on Friday. So this is video number 3. So far, we've covered sort of before the appointment on Thursday, the rest of Thursday. And so in this video, I'm going to talk about everything that happened on Friday, which was our first surgery. Before I get started into that, there's one statistic that I forgot to share that we found out on Thursday. So I want to share that and then just give a kind of a recap of all of our stats in case anyone else is going through this and kind of wants to know where our numbers were at. And then we'll talk about what the surgery experience was and all of that. So really quick first note is the reason that we were sent to the high-risk OB, I think I mentioned in the very first video, was because of I was getting blood work every 4 weeks looking for this antibody that my body could be creating. And the first couple of reads, it was detected, but at such a small level, it wasn't even measurable. So that's why we kept checking my blood every 4 weeks, because my doctor wanted to make sure that that number didn't rise. And that last appointment, it did, which is why I went to the high-risk OB on Thursday. So I want to share what that number was in case you are in this situation. So when we went to the high-risk OB, they mentioned that normally we're concerned about anemia when that number reaches 16 to 32. And she had mentioned that that's like the amount of times it takes to dilute the blood until the antibody's gone. So that's when it's kind of in that 16 to 32 range. That's when they had to dilute it that many times. That's when they're concerned that the baby could be developing anemia due to the amount of antibodies in your system. Now remember, I had 3 blood draws already where it was so small it was immeasurable. The number that came back at my last one was 2,048. So my body went somehow from like not even measurable to like insane amount of antibodies. That means it took them essentially 2,048 times to dilute the blood until the antibodies were gone. So they were kind of befuddled on how that happened, how we went in 4 weeks from like unmeasurable to that number. And we're expecting, like, I had been through some kind of event, like a car accident or like a reason that me and baby's blood would have come in contact that would cause my body to like hyperdrive. Nothing happened. I haven't had really any bleeding in this pregnancy. I haven't had any accidents. And so that's kind of another anomaly here, is just how that number got so high. So that's what kind of triggered this OB appointment and the high-risk OB with that ultrasound. And then with their findings, I immediately went to the specialist clinic. We are going to Midwest Fetal Center. The Midwest Fetal Center, I think it's called, in Minneapolis. They're like a top place that handles these kinds of surgeries, this kind of care for when a baby is still inside needs surgery, essentially. So now we make it to Friday morning. Surgery is scheduled for 7:30. I have to check in at 5:30 a.m. So we stayed at my parents' house Thursday night because they're closer to the clinic, and then they could have Annabelle, our toddler, just at their house the morning of, because we had to leave at like 5 a.m. So we left 5 a.m. Friday morning, got to the hospital 5:30, checked in. I thought we were just going to be like sitting there for 2 hours, but we were busy the whole 2 hours. I mean, they drew my blood again. They had to get an IV in, which my like arm veins weren't doing very well, so they had to try 3 times to get the IV in, and eventually just did it in my hand. They were monitoring the baby the whole time. Obviously checking my blood pressure, checking all of my vitals. So we were pretty busy that whole time, and I had a lot of different nurses and everyone come in and just check on me and see how we're doing and give us some expectations, and everyone has been amazing. Everyone we've worked with has been absolutely phenomenal. So after the 2 hours of just kind of pre-op, then we did go into the OR right around 7:30. I'm in a hospital gown, you know, the whole 9. And the actual procedure time is only about 15 minutes, but I was in the are for about an hour because it just takes a while to like monitor everything, because it's a very, very precise, very specialized surgery to do a fetal transfusion, especially at 23 weeks because the baby's still really small. And because the baby has high drops, so the fluid around the skin, the stomach, and the heart, they have to get directly into a vein to do the transfusion for a 23-week fetus. So, get into the OR. My anesthesiologist was literally amazing. I mean, she's like an actual angel. She was so, so kind. She brought her phone and let me pick any Spotify playlist that I wanted to. And so there's one that I listen to regularly called Uncovered Grace. And it's just a different series of worship songs. And so I asked her if she could play that one, and she found it. And so she put that right next to my head, and I got to listen to that playlist for the entire hour. While the actual needle was in me, she held my hand the whole time. I mean, she was just amazing. Like, everyone that I've worked with, I'm like, the amount of care that they can have for a perfect stranger is mind-blowing. Like, God-given, like, ability that they have to do that. So like I said, we were in there for a while. They have an ultrasound, obviously, and everything, and they're very carefully watching because baby's still moving. I'm awake, so I wasn't completely out, but they did give me some medicine that just made me really sleepy. And as to be expected, I couldn't really sleep Thursday night, so I woke up at 1:30 in the morning on Friday and couldn't go back to sleep. So I just played worship music. I created my own little worship playlist with 4 songs that were just helping me have faith for a miracle, but also just like humble me in just belief that God is still good no matter what happens, and just kind of settle my spirit. So that's what I basically did from like 1:30 in the morning till 4:30 in the morning is that. And so during the surgery, being able to like have a worship playlist on was so great. And then, so essentially what they do is the needle goes through my stomach, and they put it goes directly into a vein in the umbilical cord of the baby. So from my stomach into the uterus, into a vein to do that transfusion. First, they pull a little bit of blood, and they do a test to see what the level is at for the percentage of red blood cells, because that will determine how much blood they're going to put in. They don't want to put too much because you don't want to overwhelm the heart. So that's sort of step 1 is pull some blood out, test it, figure out what the percentage of red blood cells is. And this is where a normal percent is 40%. Due to the amount of fluid that we were already seeing and our MCAs being as high as they were, that 2.4 number, meaning that his blood was moving really fast. The doctor was concerned that we were between like 5 to 10% red blood cell percent. Normal is 40. He was thinking we were between 5 and 10. He was a little concerned that we would be at like 2%. Because if we were at like 2%, then he could only get us to like 6% the first time and be really slow and just that much more difficult. So luckily, when they did the first pull, Leo was at 9.9%. So still obviously extremely anemic. That's obviously the reason that we had the high drops, which is the fluid around his everything, is because he just has a very low red blood count. Red blood cells are also responsible for getting oxygen throughout the body, so just really not doing well. But 9.9 is a lot better than like 2. So we started at 9.9% red blood cells. From Friday's transfusion, we were able to get him up to 19%. So much better, still not, anywhere out of like the danger zone yet, but significantly better than 9.9. So 19 is where we landed Friday morning. The other big concern was that it was his first transfusion, and there was a chance that his body just wouldn't accept it, meaning the transfusion could stop his heart altogether and he would die. So big wins on Friday. He took it really well. He did totally great throughout the surgery, and we got him from 9.9 to 19%. So grateful that went well. So grateful that he made it through that first one. We all feel really good about, if he made it through the first one, then the chances of him, continuing to take the transfusion well is that much greater. So really, really grateful for that. So I mentioned that my anesthesiologist was amazing. I got to listen to that playlist the whole time. She held my hand while the actual needle was in there doing all of this stuff. I don't even have, I think it was one stitch, and they didn't even put a Band-Aid on my stomach. So very minimally invasive for me, which is great. So once they were all done doing the transfusion for him, did that one stitch, then I was out of the OR, and then they just checked on me for the next hour. So just checking my blood pressure and my heart rate and stuff. My heart rate was pretty high after the surgery because of the anesthetic that they give you. So my resting heart rate is normally around 75, 80, and it was 146 for a while. So they just gave me some more fluids through the IV to kind of help that just settle down. They let me order breakfast, so I was able to eat breakfast there while we were just watching everything. And then we were able to leave. And so that whole set took about 4 hours. So getting there 2 hours early, being in the OR for an hour, and then follow up for an hour. So about 4 hours. It's an outpatient, so then I was able to go home after that. I didn't have any pain the rest of the day. I didn't need any painkillers or anything. Like I said, really grateful that it's minimally invasive for me, because I'm going to have quite a few more of these throughout the pregnancy. And we can talk about that more in Saturday's video. Today is Saturday, and so I'll make a separate video for that kind of talks about the plan going forward. Hold on one second, honey. You hit your head on the table. I'm sorry, honey. Oh, sure. Thank you, honey. Frosted mini wheats I'm getting brought. So I think that pretty much recaps everything that happened Friday morning. Took the rest of the day easy. I don't have any restrictions. I'm not on bed rest or anything. Just kind of take it easy, I guess. So, yeah, just kind of relax the rest of the day, and I'll update you in the next video. Thanks for watching, following along.